Hello, everyone. How's everyone doing this fine Wednesday? Sunny out here in New Jersey. Hope everyone's doing well. Hope everyone's managing to keep their sanity during this coronavirus restriction period. Today we wanted to, with May being Lyme Awareness Month, wanted to talk about Lyme disease and coronavirus and how we think it's not a good idea to have either one of those, but especially not to have them simultaneously. So, it seems like that could very well be a possibility in this as the ticks are coming out right now. So I'm going to talk about corona and Lyme symptoms. I'm going to talk about the immune system and what happens with Lyme, chronic Lyme, and steps that you can take to minimize your risks. So, coronavirus symptoms. This has certainly been in the news quite a bit lately. And the symptoms, the predominant symptoms are cough and fever, muscle aches. Some people are having sore throats. Some people are having diarrhea. So it's important if you have any of these symptoms, especially if you're experiencing severe symptoms, that you should be tested and you should be isolating. Lyme disease symptoms. About 2/3 of people get a rash. But that leads to a significant number of people who don't get a rash and don't know that they've been bitten by a tick until they develop fever, joint pains, usually the major initial symptoms of Lyme disease. If you get treated with antibiotics at that point, some people do great and the Lyme disease goes away. Some people are then left with more of a chronic Lyme picture where they could have fatigue, sometimes what people have described as overwhelming or crushing fatigue, muscle pains, cognitive difficulties such as brain fog. So if you have any of those symptoms and you don't know if you've had Lyme disease, it's always best to get tested. So, why, we are talking again about coronavirus and Lyme and why you be a bad idea to get either one of those, but also, especially if you get them together. One of the problems with Lyme disease is that it causes a severe inflammatory response on its own. I had a patient who I saw who had acute Lyme, and we had done a CRP, C-reactive protein, a marker of inflammation for another reason. And normally that's in the range of 1 to 3, 3 to 10 being, somewhat elevated. His marker was over 100, and I was like, whoa, what is going on here? It turned out that it was acute Lyme for him. This was back last year, and he recovered nicely, and his CRP came down very nicely. So he's doing well with that. So again, with Lyme, you can get a severe inflammatory response. Coronavirus also causes an inflammatory response as your body mounts that immune response to the virus. In some people, it can cause an excessive inflammatory response, the so-called cytokine storm. And when that happens, tissues can be damaged. It can lead to respiratory failure, multi-organ system failure, and even death. So obviously we want to avoid that. Please check out our other posts for more discussion about that and supplements you can take to help have your immune system strong, but modulated so you don't get too an excessive inflammatory response. Because with a strong immune system, you could be one of those people who's exposed to coronavirus and maybe you don't get it, or maybe you get a very mild case and you don't end up with any severe complications. So that's our hope for our people in the functional and integrative world, that by modulating their immune system, and that they will have either not get it when exposed or have a much milder course. But if you get coronavirus and you get Lyme disease at the same time, again, the Lyme causes that severe inflammatory response. If coronavirus gets added on top of that, it could spiral people. The worry is it will spiral people into that severe inflammation that results in the cytokine storm and causes the respiratory failure. And again, death is for some people, death from that, from multi-organ system failure. So obviously we would like to avoid coronavirus. We'd like to avoid Lyme disease. Cases are going down in New Jersey and New York, so the case is going down. Hopefully, if you haven't had it this first round, maybe you're not going to get it. But if you do, again, hopefully with the modulated immune system, you'll do fine. But people with chronic Lyme have a slightly different issue. Their immune system is kind of depleted somewhat from trying to battle the Lyme. So they are more likely to get it if they are exposed to Lyme disease. If they do have more of an inflammatory component, again, they would be at risk for having the cytokine storm. So, for those people with chronic Lyme, they should be seeing an integrative or functional practitioner so that they can support their immune health, have it in the best possible shape that it can be in to deal with coronavirus. So they are, I would believe, an at-risk group, and they should be seeing somebody who can help them. If you live in New Jersey, certainly you're in an endemic area for Lyme, so I would suggest being tested if you have any suspicion at all, any of the symptoms, any, other people in your family, everybody else in your family has had Lyme disease, but you haven't had it. I would suggest getting tested, and we could support that testing if you need help with that. So how do you support your immune system? We've been saying this, we've been beating the drum on this. First let's get to, do the basics. Get good sleep, 7 to 8 hours per night. If you need help with that, a lot of people are anxious, talk to somebody that can help you with that. It's important to get good sleep because when you sleep, it gives your immune system a chance to renew itself, regenerate, and, be in optimal shape to help you with coronavirus or Lyme disease for that matter. But, primarily coronavirus right now. For the Lyme, it's going to be avoiding the ticks as much as possible. So first good sleep, then activity. Get up, move around, move your body, however you want to do it. I love to fake dance with my grandchildren, play hoops with my grandson, get my exercise that way. We go for walks. Took my grandson to Baldpate Mountain and hiked for about an hour and a half there on the weekend. Whatever gives you joy, whatever you can do to get your body moving, because when you get your body moving, you are helping out your immune system. You're lowering your inflammation in your body. So movement, activity is important. You need to eat a good diet. whatever you want to say about what you think is the best diet, low sugar, low carbs as much as possible is the best. Certainly low sugar. Drinking soda is not a good thing. When you drink a sugary drink, taking a lot of sugar, you actually suppress your immune system for the next 4 hours. So that is not a good idea at this time. It's never a good idea, but at this time it is particularly not a good idea. So I know some people are turning to comfort foods and that kind of thing to deal with things, but try to find something that doesn't have a lot of sugar in it. Coping better with stress by doing meditation or prayer or, yoga, Tai Chi. There are, you can get all these things in your house now. Whatever puts you into a relaxed parasympathetic state is going to help your immune system be better able to respond. And last but not least, targeted supplementation. Working with a practitioner who can help target your supplementation. We do have the post on our Facebook page about the supplementations that's recommended in the first phase of Lyme. And to help prevent you from getting Lyme. So that's on our Facebook page. Please check that out, and check out Jenna's Immune Support and More group for other information. So to avoid acute Lyme, we have to take precautionary measures, just as we have with coronavirus. With coronavirus, it's social distancing, wearing masks, hand sanitizers. With Lyme, to avoid Lyme, we should become more vigilant and take measures to avoid tick bites. We should use insect repellents. I posted on our Facebook page a list of natural insect repellents, so you don't have to use the harsh chemicals on you or your children or your parents, maybe. So that's posted on there already. Some people at the highest risk, I know, are using permethrin impregnated clothing. Permethrin is similar to the chemicals that are produced by chrysanthemum plant as a natural insecticide. I think that there's probably some better alternatives on the link that I put, though. But if you're at super high risk, you may want to consider it. And so that really is it for the presentation. Let me see what questions I have here. And hello to everybody who's here. Thank you for watching. Hello, Nancy, Mary Kay, Shelley, Kerry. Nice to see all of you. So Nancy says, what's going on with the pediatric population having an offshoot of COVID? Seems more serious and more cardiac than respiratory. So even in adults, Nancy, there is, usually what ends up killing people are cardiovascular complications, probably from the low oxygen in the blood, and people are suffering, heart attacks and arrhythmias from that. Serious complications in children are much rarer, but they do seem to be having some inflammatory responses in and around the heart that may be more prominent than their pulmonary complications. We do have to remember that children do have their lungs are young and resilient, but unfortunately there are some children, even from other diseases. For example, Kawasaki disease is an autoimmune disorder that causes vasculitis of the heart. So this is more of an infectious vasculitis, and it is sad and terrible, but it is happening to some of the children. Fortunately, it's pretty rare. So, but now we know, not all age groups are safe, but we can say that serious complications in the younger children are pretty rare. Obviously, they're devastating when they happen. Let's see, Mary Kay asks, is the sensitivity and specificity of the antibody test, as well as quality, good enough to start getting the test? I was late and may have missed it in the beginning. Yeah, I didn't actually talk about that yet, Mary Kay. So I think that the sensitivity and specificity of some of the tests, I think the, tests, labs that do immunology routinely, certainly would be well equipped to handle something like this. I think that's good enough. The question then comes in, well, if you have antibodies, are you immune? Even Dr. Fauci said that, a positive antibody test is not proven to show immunity. It's likely that there's going to be some immunity, some temporary immunity, but we don't know yet. This disease is too new to know that. I would, I think for anybody who's interested, I think that the testing is good enough now to get it done. So, hope that answered that question. Other questions from people? All right, well, Mary Kay, please tell Jacob I said hi. Hope everything turned out well with everything. So, all right. I will be back on Sunday morning at 9 a.m. People have, anything that they want me to talk about, particular questions, please message me. Probably the easiest way to reach me. And I will talk to you soon. Please stay safe. And again, thank you to all the people on the front lines, those healthcare providers that, certainly the ones who are in the hospitals, but also the ones in the offices who are having people come in who might have COVID. And also all the people providing essential services. All my thanks, gratitude, and prayers go out to them also. So, anybody in your family or whoever you run across, please thank them from me. Okay. All right. I'll be back on Sunday. Take care. Everybody have a wonderful day.